5 on your health tonight. A new national effort to screen more adults for anxiety disorders leaves some of our viewers asking, well, what about kids, right? Well, here answers Dr. Erica Lee, a psychologist at Boston Children's Hospital. Good to see you, Dr. Lee.
Hey, Dr. Lee, it's great to see you. So question one, as you know, the U.S. Preventive Services Task Force already released guidance about kids. So boil it down for us. What did it recommend?
Yeah, so the task force previously said that all children 8 to 18 should be screened for anxiety regularly at their doctor's visits. And now they're actually extending that recommendation. So now they're saying all adults under the age of 65 should be screened at any kind of doctor's visit for anxiety, especially those people who haven't been screened before. So really what this is saying is that everyone from 8 through 65 should be screened for anxiety using standardized questionnaires that identify anxiety symptoms. And anyone who screens positively should be referred for further evaluation and support.
That is a huge population, Dr. Lee. I mean, that's a huge number of people. Wow.
Let's talk about symptoms. How can a parent tell whether their child is having a panic attack or maybe if it's just something else?
This is a great question because I think a lot of people have heard of the term panic attack, but don't necessarily know what the symptoms are. So when we think of a panic attack, these are characterized by this very intense and acute set of both physiological and emotional symptoms. So some of the things we typically see are shortness of breath, your heart's beating really fast, you feel dizzy, shaky, sweaty, or nauseous. But also people often have this intense fear that something really bad is happening to them or that they're losing their mind or control. And this typically just comes out of nowhere. So it's actually quite hard to fake, because what you often see, especially with kids and teenagers, is it's a very overwhelming experience to have. It's not uncommon for us to see folks in the emergency room because they think I must be dying or having a heart attack, and they're actually having a panic attack.
Right. Well, Dr. Lee, as parents, we certainly want to believe that our kids will grow out of those panic attacks or other anxiety disorders, but in your experience, does that typically happen?
This is a fantastic question. It really does depend on the child. And the way that we think about it as psychologists is there are, of course, some fears and worries that are developmentally appropriate and that kids will often outgrow as they get older. So what you want to keep an eye out for with your child is, are they having developmentally appropriate anxiety, or is there some anxiety that's kind of lingering around that you wouldn't expect for their age? So for example, once kids start going to the school, are they still having difficulty separating from their caregivers, which is a little bit less common at that age? Or are the things that they're worried about getting in the way of their play at home or at school? If your child doesn't seem to be growing out of these things or it's impacting their daily functioning, you definitely want to talk to your pediatrician or a mental health provider to better understand how to help.
Makes a lot of sense, Dr. Lee. We always appreciate your insight. Thank you.
Thanks, Dr. Lee. Take care. Good to see you.
Good to see you.